Excellent. Hello, my name is Brian,
Hi, this is Vipin.
and today we're going to be reading off some questions and trying to see if we can have some therapeutic responses that confer with what we've been learning so far. So, jumping right in, question number one. You are dealing with a client who hints that she is sexually attracted to you, i.e., I'm not sure I can speak with such an attractive nurse. At this point, this is a great time for me to establish those limit settings. You can gently say, "Wow, thank you for the compliment, but I am your nurse, and we have to keep our relationship as civil as humanly possible. Is that going to be a problem going forward, or would you like me to maybe get you a female nurse?" We can offer kind of a little bit, if there's staffing, but, firm limit setting, I feel. How about you, Vipin?
I totally agree to you, Brian. I would be doing the same thing, as you said, setting the professional boundary at the same time without, without uh, making them feel embarrassed or unheard, So I would say, again, as you said, thanks for your compliment. But my role here is to support you in your mental health journey. And also, instead of ask, I would rather offer, like, redirect the conversation by offering some, for example, a warm blanket or a coffee or something like that, if that works. Or I totally agree to you, like asking them if you want a female nurse, if the staffing permits.
Yeah, that's very professional. I like that distraction. That's actually really clever. Um, Question number two. You are counseling a client who has become demanding, i.e., if you can't talk to me for an hour, I don't think you care enough to help me. So this is an interesting one. So at this point, I think I would use a little bit of therapeutic self. I would just try to take a moment and say, I do care about you. You are a priority to me, but you must understand I have X number of other patients, and I want to divide my time equally amongst all of you so that none of you feel left out. So I want to talk to you. Can we establish, maybe if you have 10 minutes, try to give them that 10 minutes and then say, we're going to set a firm 10-minute, parlay. And then I'm going to do a couple other things. And if we need to, we can come back to chatting a little bit later.
I totally agree to you, Brian. Yeah. So most probably the client would be worrying, like, sounds like they are not feeling heard, or they are worried like they don't get the support they need. So in that case, as you said, I won't be giving a false promise that I will be staying with you for 1 hour, but I will divert that to a conversation where I would say, as you said, focus on the most important thing that they want to discuss with us,
Mm.
and I will come back to you in a different point, like a different time, where I have enough time, like I've done with other clients. That would be my response.
I like that you talked about the most important thing to them. That's actually really clever because another tact I use sometimes is have them go and write down things they want to talk about and then choose from those things
Oh yeah.
what's most important from that. So you're kind of letting them go off, activate their mind and preoccupy themselves for a period of time, and then they
Mhm.
come back to you with kind of like a list, an itinerary.
Oh yeah.
So that's very clever. I like that. So question number three, you are feeling confused and you are not sure what to do in the next interview. Obviously, this is probably going to hit us a lot. I'm feeling that in my clinical already. Like I go in and I have a conversation, and sometimes I feel like, oh crap, I didn't ask them about this or I didn't ask them about that. And so you don't want to go in with your own itinerary of like questions and hoping to get answers. But in this context, I personally would reach out to one of my mentors, with more experience, and I would kind of say, hey, can you kind of give me a tip? This person, let's say their suicide, recent suicide attempt. Hey, can you give me like a quick little, what should I talk about? How should I engage with this client, et cetera? Whatever you're worried about. talk to your experienced nurses.
Exactly. That's a very valid point, like seeking help in that case. Like we feel like a blind spot there, right? So what I was thinking is like in that situation where it happened with me previously, what I tried I tried a different technique, like, I started asking them in a way that, okay, let's say, what is it bothering you most at this point?
Mhm.
So that if they say, as you mentioned, like a suicide ideation, in that case, if the client says like, okay, I feel terrible and I feel like, doing something self harming or something, from there, probably I would be able to pick up again. So a little bit thought, I don't know whether it will work out, but I think that way.
Nice, nice. All right, final question. Your client continually questions your training, i.e., you seem really young. I don't know if you can help me with this problem. Or did you go to school for a certificate because I'm not sure you know what you're doing? I mean, nurses new to the world. I've seen it and heard about it 100 times. They have that imposter syndrome. It's something that I think we're all going to experience. In less than 4 months or 5 months, we're going to be nurses. And that even right now, I'm like, oh my gosh, am I ready? Um, you just have to rely on your own level of confidence. And in this moment, you can say, something along the lines of just get an idea of why they're saying that to you. Like, does age matter to you? Is age an important distinction of, people that you look up to, or about the level of education? What do you can ask the client this. What do you think the difference is between a certificate and a diploma and a degree, et cetera, just to gauge their general understanding so you can kind of educate them from their level of understanding.
Yeah, that sounds good, Brian. So, yeah, as you said, like keeps the response casual, and also they feel like we are still approachable, like we're not getting angry or anything, while maintaining that professional approach. So I would also respond the same way. I will also add, like, so I have this kind of training and experience. I think this would help me to support you. So, what's most important for me is to make you feel comfortable at this point. And if you want to discuss anything important that you feels like as of now, you can talk to me. That will be my response.
Excellent. Well, I think that does it for us. I think we nailed it. Well, thanks
Thank
a
you so
lot,
much.
Vipin. I appreciate
Bye.
the chat.
Thank you. Bye.